Greetings to the participants of the Ending Age-Related Diseases 2021. This conference brings together thought leaders and researchers working on rejuvenation biotechnology with the goal of extending healthy human life. Introducing longevity interventions requires overcoming regulatory barriers, educating the medical community, and discussing the price tags. But we all know that making treatments available does not guarantee life extension, as there are other factors at play. The current pandemic uncovered many weaknesses in the healthcare systems around the globe and made that clear that if we want to increase life expectancy, then we must adopt a holistic approach. These are the questions I'm discussing today with Tina Wood, CEO of Collider Health, an ecosystem architect working with organizations in both private and public sectors to accelerate innovation and achieve sustainable transformation of health systems. Tina is also the key driver of the All-Party Parliamentary Group for Longevity that is working with the UK government on the goal of adding 5 extra years of healthy independent life for everyone by 2035. Hello, Tina. Thanks for joining us today.
Thank you so much for involving me. I was involved about a little over a year ago in one of your conferences. It's really nice to be here again.
Let us discuss your work a little bit. What do you think is the most important achievement of the work of the All-Party Parliamentary Group for Longevity that you managed to achieve since its inception?
Policymakers and government are always, in some ways, going to be a step behind, obviously, the sheer pace of change that's going on in the scientific and technological world. We know that. And of course, you I guess you need to have some sympathy. I guess, it is really difficult, even for the ones who are in it, it's difficult to keep pace. So I think the one thing that we knew we had to do as part of this process of engaging government and policymakers is this whole process of opening eyes, to all the stuff that's going on, but seeing it from multiple perspectives. So we made a point of engaging with all the different perspectives that had a role to play in this sort of system change thinking. So it's about the scientific community and obviously the technology community. It's about the business community. It's about third sector. It's about the NHS, but it's also about, the general public. So we spent quite a lot of time, developing our group of experts and people that we felt should be at the table, and then going through this process of sort of drilling down with all the different perspectives, then coming up and comparing and contrasting views. And again, we were very, very focused on this North Star goal of HLE plus 5. How do we achieve healthy life expectancy while minimizing health inequalities? And bearing in mind this was right before COVID. So we and very, very quickly, within 9 months, we kind of got together around the table, many, many times, and managed to come out with 9 recommendations, 2 of which are very, very advanced now, because we had to because we published our strategy for a healthier, longer life last February. So it was right before COVID struck. And it was funny because I'd just come back from Singapore. I'd been invited by the National Association of Medicine Global Healthy Longevity Program to speak about our work. And I remember when I hit the hotel room in Singapore, it was like temperature checks and everything, I had a bag with, the mask, and, it was just COVID had just started to kind of get on the global radar. And then when I got back, it was sort of like, oh gosh, is the UK going to be affected by this? But we launched a strategy and of course had the support of our Secretary of State and had got a lot of, acclaim for how we approached it in terms of distilling down what are the 9 key things we really need to get right, from all these multiple perspectives. And then COVID struck. And then, we sort of had a look, and we could see when the data was first coming out that actually our recommendations were even more compelling, because it really was focusing on, this sort of system change around health prevention, around addressing health inequalities. But the 2 recommendations, which so I was really proud of that, obviously. And of course, just more recently, about 3 months ago, we published our follow-on report to say, life has moved on, the world has changed. What should be our short-term priorities? So we sort of contextualize, I guess we try to be quite pragmatic about, the short-term priorities. And of course, we have a new government, a new prime minister. And so we identified sort of a handful of priorities that certainly in the next sort of political cycle we should focus on, because there's always that balancing act, the here and now, what we can do now, and the long term. And we know that government and our institutions, they run on fairly short timeframes, which I think is a big challenge, because of course, they're thinking kind of 5-year horizons. And of course, when you're thinking about health prevention and certainly healthy longevity life course stuff, you're looking at really, really long time horizons, which will have a payback that takes a long, long time. So that's a massive, massive challenge. But two of the things that we're working on now is we've formed a business for health venture, which is looking at developing a business index to measure and incentivize the business contribution to health, because the business community is a massive stakeholder in all of this, which has been really underrated, from a public health and population health perspective. So we want to find a way to actually measure, the role of business in health, and that's in 3 key parameters, which is around employee, health and well-being, and sort of, the workforce health bit. We know, and the data you will see that mental health and musculoskeletal disease, musculoskeletal conditions, as well as even things like headache and backache, things like that, these have massive impacts on workforce health and actually create big pressures on our healthcare systems to address. So that is an area through better health interventions at a workplace level could have a massive impact. So again, it's sort of looking at that one impact alone could make a massive difference. The other level down, of course, is business impact in terms of the products and services. So there are many products and services. Certainly, this was the work of my the UK Research and Innovation work, the Healthy Aging Challenge. We were trying to stimulate that marketplace. We want to see more products and services to keep people healthy and well. We want to engage people, in new technologies. Certainly, what has come out through COVID, the COVID experience, is how important communities are in generating local health resilience building. So, we have various sort of policy drivers at the moment, which are really trying to create much more kind of localized sort of, public health intelligence systems, so that it's not just sort of centrally driven. And I know the states is different. You've got, your 50 states, it's much more sort of federated, but we're kind of moving in that direction, certainly in the UK context, where we're taking more of a place-based approach, recognizing that, organizations, our public health systems, but also businesses, social enterprises, local community organizations, they all have a massive role to play in terms of communities and regeneration of areas that have been left behind. We have a whole program in the UK, Levelling Up Health, which was the focus of our recent report, is like, how do you create a more sort of equal playing field in the health of local populations? So business has a massive role because they employ local people, and of course we know that even things like good jobs, living, good wages, that has people in low-paid jobs tend to be much less healthy, and it's part of this whole health inequality situation. So there's a massive role in that resilience building and local community building and this wider societal impact that business has a role to play. And so we're looking at all these, aggregating up a very simple way to standardize and measure the business impact of health. And of course, we have industry specific, we're looking at specific industry sectors. I mentioned the food industry, so that's very high on our map. We're looking at housing. We know that housing has a massive impact, and we need more better social housing to house people in better environments where it's not overcrowded, have access to green spaces. Looking at transportation policies, so people are encouraged to walk more. These are all things where government can have a huge role to play to create a better environment for people, better playgrounds for kids, and of course, to the point earlier, the legislation policy drivers to encourage better practice in the food case, but actually most fundamental is, and which I'm really excited about, is taking a leaf out of the climate change experience and bringing health into ESG mandates for investment for significant long-term patient capital into very bold, transformative approaches to health prevention and also care, because we need that, and we need much longer-term horizons, which the investor community can do, and be much more bold about the solution. So we're creating a framework where we're bringing health into ESG mandates, and so the business index is the precursor to that. But we kind of want to do what climate change has done, which is about 10 years ahead of us. Just like the big investors and pension funds, they're disinvesting away from coal, from fossil fuels. We want to see the same thing happen in health. We want disinvestment, as we've already been seeing in tobacco and even now alcohol. We want to see that in health harming industries. We want to disinvest from ultra high processed foods. We want to have that kind of that mentality where good, sustainable, responsible business investment is commercially attractive, as we're seeing in the climate change space. So those sorts of things we're looking at in the Business for Health initiative that came out of the initial work, and I'm very involved with that. And then the other thing that is very significant to mention, which has more of a, I guess, a link to the kind of the science technology end, is we're creating an open life data framework we're calling. We deliberately avoided the word health because we wanted to take the life course, the kind of life trajectory sort of approach to this, and look at, because the massive focus at the moment with all of our policy and of course our life sciences industry, which is very strong in the UK, as you probably know, and biotech, moving that away from just looking at the sort of the data in what we call the kind of the sick care space, because NHS and care data gets the lion's share of attention in terms of policy investment, and looking at the wider determinants of health. And of course, big tech are very, very conscious of all the data points in our lives, and of course is very much at the heart of a lot of the work I know the longevity scientists are looking at, digital fingerprints, and other biomarkers and all the rest of it. So we're trying to create an open innovation environment with the right governance mechanisms to open up much better data sharing and connectivity, much more awareness about what we can do to develop products and services to keep us healthy and well, to develop the insights to identify disadvantaged populations, all these sorts of things, which will be unearthed through this open life data framework, where we're taking lessons from open banking, which has been very successful in opening up the innovation ecosystem for fintech. We want to take some of those lessons learned and bring it into this space. So that's a very busy project at the moment. We're going to be publishing a framework in the next couple of months. And of course, so private sector data is obviously very much a focus of this. And of course, that's obviously what we're looking at in the context of the business index that we're developing within Business for Health. And all of this, we're aligning around another very interesting piece of work in the UK, the development of the ONS Health Index. So the Office for National Statistics are developing a health index, which is taking an asset-based approach to health, which is around healthy people, healthy lives, and healthy places. So we're trying to align all the thinking around a different view of health and looking to other models like we've seen in New Zealand, for example, where they're measuring the success of their nation on health and well-being and not just GDP. So it's a whole new way of thinking about what really matters to nations and societies. So it's kind of, again, looking at the systemic kind of approach to global challenges and the opportunities to kind of address them through a different way of looking at the world and the problem and also the solutions.
That sounds wonderful. Actually, really, you are doing an impressive piece of work, and this is something of an incredible complexity in my view. So I will be very curious to learn how did you manage to engage so many stakeholders at once to discuss the creation of those healthy longevity ecosystems. Obviously, it's been a success, and I really hope that this positive trend will proceed. What's your secret sauce when discussing longevity topics with all those stakeholders? Many of them can be actually pretty new to the field. So how important is language?
I think for a start, you need a shared language that resonates with as many people as possible. So what's been really, really helpful, and it's so important, is to have that mission statement that you can't really argue with, that everyone can get behind. So from that perspective, the UK goal, which is in our current manifesto commitment as well, achieving the healthy life expectancy while minimizing health inequalities, that is something that is declared. It's a North Star. You can bind everyone around that. Now, how you get there, it may be that different stakeholders have different ways of seeing it, but actually you can break down those initial barriers by being very focused on that goal. So that was really, really helpful. And I think and it was very, very interesting because I think the whole language, and I think language is really important. I know I've spoken to many people about this idea of creating almost like a lexicon for longevity, so that we can all be speaking the same language, because there's so much confusion. I mean, what do we mean by aging, ending aging, and what does longevity mean? What does healthy longevity mean? There's a lot of confusion. And I think if, having that simplicity of the language, and so, for example, I have noticed that because of the mission statement that we had, we've started talking, because we've been much more positive about how we see it and how we can get to achieving this goal, rather than seeing always as a problem, is already the language has shifted from healthy aging towards the idea of healthy longevity, because it's a more empowering language. And unfortunately, aging is still tinged with this negativity and the kind of the ageism that does pervade, unfortunately, a lot of the Western world. We still see aging in very negative terms. So I think having a more positive language does open up the opportunity and the optimism around this. So I think it is important. But I think ultimately, when you're bringing such diverse stakeholders together, in the end, you have to have messages that will resonate with them, so that they listen as a starting point. They need to listen, but then it's about engaging, but then it's about action. So coming out of the pandemic, what I find really interesting is that we realized, kind of like just seeing, for example, our sort of westernized society completely driven by, I guess, the sort of the old way of seeing things through GDP and profit-driven growth and all these sort of things. I think we're starting to see things, quite differently now. What else is important to human beings, to society? And that has come out really strongly as a result of the pandemic. So language is important. I think the mission is important. But I think also, and we're getting more, I guess, hard and fact data about how closely health is connected to wealth and prosperity, because you can't really argue with that, because that gives an incentive for the business community. It also gives an incentive to policymakers to focus on health and preventative health by seeing the economics of it. And I only have to, point to a few, very, very gold standard reports. I mean, McKinsey do some great work. I mean, they've done, sort of putting a cost ill health and, what you will gain. I mean, they've kind of calculated, I think, by addressing preventable health and the diseases that lead to poor health, you're looking at a 10% uplift in GDP just by addressing, all the disease that we are currently getting in terms of chronic diseases that could be prevented if we change our lifestyle. So that's massive. And my colleagues, I know Andrew Scott and David Sinclair, they worked on a really interesting paper that was more specific to the sort of the aging question, ending aging, but they showed, the sheer uplift, that you will get by, slowing the pace of aging and increasing, life expectancy with good health will, I think their calculation was it would add $38 trillion to the USA alone. I mean, in terms of net gain, I mean, these are massive figures. So I think once you get the economics showing, what the cost of ill health is. And we know that has a massive cost in terms of productivity and taking people out of work. And of course, then they're not less economically productive, and they lose their will to live. I mean, and then, and you can see that with the opioid crisis. I mean, once people lose their purpose, and if they're in ill health and they're not able to work and contribute to society, it has these huge impacts. And if they're not able also to care for others, it's a massive, massive impact on the bottom line for society, economically. And of course, the sheer social costs are just absolutely gigantic. So I think the economic arguments are becoming much starker and clearer about why addressing our health, through, longevity science, but also, and I have to say, and this is, I guess, the message that, I would put forward, is that we have to understand that, ending aging and attacking the root of aging and understanding, the chronic diseases of aging, that's a very important part of it. But such an important part is addressing the wider circumstance of why it is that we get trapped in ill health. And that's a much bigger question, which sometimes gets neglected, but I think does need to be very much part of the solution in terms of really delivering on this healthy longevity for all people.
Thank you. I think that's a great piece of advice. I wanted to ask one more question about the language, though. Do you think, well, you're in this field for several years, right? Did you feel that there was a shift towards some more positive views on life extension as opposed to, just health extension lately in those meetups and groups and collaborations that you are setting up?
So that's a really interesting question. And I think for those who are more in the know, and I'm talking for those who are slightly more advanced in, in the scientific community and sort of longevity research in general. I mean, I think, we can see that, really the ultimate goal is to see this convergence of health span and lifespan. I mean, you want minimum, morbidity to the end and all these sorts of things. And I think, but what I would see though, outside of that is there's much more use of health span and lifespan, because I think this growing recognition of how important our health is. I just think it's, and also just realizing the significant issues that we have with healthy life expectancy. The big policy focus in the UK, I know, has been very much on healthy life expectancy rather than life expectancy, because what we've seen is just the sheer magnitude of the gap between the years lived in good health between the poorest and the richest in society. So I think it's to do with a social. There's a social question, I think, that has come up and has really put the focus on this whole issue around health span. And I think from a policy perspective, I think it's much easier to focus on it. It's more of an imperative than on life extension, because there's no point in extending your life if you're going to have a crap life. So how do we address that question? And at the same time, recognizing that a crap life is often linked to your health status, which is then, of course, linked to the other determinants of health. So I think that's where it has focused, certainly in, through the policy lens and the government lens, because in the end, the government priorities, are going to be different from longevity scientists. So, that has to be understood. So it is about how do you create that shared language? And I would say that shared language has converged around the Healthspan aspect of it. But I think as people get more aware of that, the gap, closing that gap in morbidity, because of course most of our resources are spent on that final stage of life at the moment when we're dealing with these very, very chronic complex multimorbidities. I think it's something like 15% of the NHS budget goes in those last 2 weeks of life, which is crazy. We need to shorten that. We need to focus on keeping us healthier. So I just think it's creating the right arguments for the stakeholders. Healthspan is very much more the focus in terms of the policy lexicon than lifespan.
So one more question then, taking into account all the enormous amount of information that you have collected during your work with the All-Party Parliamentary Group on longevity, and everything that we learned from the situation with pandemic, what do you think must be the key actions and key projects that the policymakers should be focusing on?
I mean, I'll talk from the experience, certainly, of the work that we're doing, in the UK context, but I think a lot of the messages and action points are similar for other Western nations and certainly in the US. The main takeaways is that we cannot separate health and wealth. It is totally connected. And I think we need to keep on seeing health. And I think this has come out of the pandemic. It is our greatest asset. And we need to protect, we need to do what we can to keep us, to develop our health trajectory, through all the technologies and scientific advances, and also policy innovation that we have. And I think also, we do have to realize that, we can't really improve healthy longevity, healthy life expectancy for everyone without dealing with the health inequality situation and the systemic inequalities. So I think that is a really big message for all of us. And I think sometimes, when you're so excited by the research, you have to kind of keep going back to the reality of people's lives day to day. And I think, we also have to realize that so much of our health is shaped by factors outside our control, which is why government policymakers do have to step in. It's about the wider circumstance, the environment, in which we thrive or don't thrive, and access, to new technologies. And I think the other thing, which I think is worth mentioning, is that there is something about us human beings that, I don't know if can be answered by science. There's something that, there's that sense that drives us all forward. And you'll see that, what drives our curiosity and certainly the ambitions and interests and ingenuity of our scientific community. That's really important. And that's kind of like, it's not, so our survival instinct, it's not just hardwired in our genes like it is in animals. There's something else that you can't really kind of necessarily answer purely through science alone. So that is also a really important part, is that, it's about creating a society where we all have really great lives, because we don't want to live forever if we have, if we don't have a good life. So that's a really difficult question to answer. But I think, fundamentally, health and wealth is so fundamentally connected in terms of our future prosperity. So we need to focus on that.
That's a great answer. Thank you. I'm very satisfied with it. I personally really value opportunities that people have in terms of developing themselves, becoming better, getting education, pursuing, professional careers. Even by giving people those opportunities, we can achieve more. And I'm actually a big fan of the ideas of Jacques Fresco in this regard. The Venus Project actually has many great ideas, and this is one of them. Give human being an opportunity to properly develop, provide the resources for development. And you will see how this can dramatically change not only their life, but also the life of our society at large, and how innovation can thrive much better and much faster in such an environment.
That's such a nice way of leaving it. And I was just going to say one final thing is that our young people, who are out there, they have been so fantastic and so generous, to all of us older generations, throughout the pandemic. And that spirit and that hope and that optimism and that kind of social consciousness, I think is so important and will really push us forward. So we need to respect that, and we need to nurture that.
Wonderful. That's a great roundup. Thank you for joining us, and I hope that you enjoy the rest of the conference. Thank you.
Thank you so much for everything and for involving me. So thank you so much.